everybody, and welcome back to another episode of Mommy Virtue, brought to you by MetroHealth. I am Ro, and today we're going to be talking about balancing mental health and motherhood. Motherhood is a transformative journey that deeply affects a woman's mental health, bringing both joy and significant challenges. However, these struggles are not just limited to pregnancy and postpartum. About 12% of women in the U.S. face infertility, which can take a deep emotional toll. And in today's episode, we're going to be speaking with MetroHealth OB-GYN Dr. Alexandra Berra, exploring common mental health struggles that women face before conception, during pregnancy, and after birth, and how family, friends, and other loved ones can provide compassionate care and support during this challenging time. So welcome. How are you?
Thank you for having me. I'm good. How are you?
Very good. I love the blue.
Thank you.
Looking very bright and just vibrant today. So the topic that we're going to start off with is a touchy one, and I feel like something personally I've dealt with is not something that a lot of women like to talk about openly. So let's just jump right into infertility. And you know, it's an incredible emotional experience. What kind of mental health challenges do women commonly face when trying to conceive?
Yeah, I think it's definitely tricky, and we see patients in my specialty while they're trying to get pregnant to address their other needs, and I think addressing mental health is a big part of it. I'd say a lot of patients who are facing struggles with infertility have anxiety, depression, or even stress-related disorders from what they've been through trying to conceive.
Yeah, for sure. While pregnancy and postpartum can be joyful, of course, what are some emotional or psychological struggles women face during or after their pregnancy?
I think pretty much the same. I think a lot of people enter their pregnancy with these same struggles. Anxiety and depression tend to be the top two that we talk about, but PTSD and other mental health disorders are definitely things that we need to work on addressing as well.
Okay. Now, I know in the baby and pregnancy community, a lot of times you hear the phrase or term baby blues. How is that different from postpartum depression?
Yeah, so separating the two can be challenging. Baby blues is fairly typical. I think a lot of postpartum parents experience baby blues, which is, occasional being upset, crying. Depression takes it a little bit further. There can be anger associated, and one of the biggest differences too is a difficulty attaching to their newborn or feeling distance from their baby, and I think that letting them know that that is a symptom of their depression is one of the best things that we can do for them.
Yeah, and I love that it's something we're talking about because I feel like it's just not common to talk about per se, and then it's like sometimes you kind of question, or women might question, like, is this normal? And am I supposed to be feeling this way? So talking about it definitely helps, I'm sure. Outside of postpartum experiences, what are some other mental disorders that women might face after pregnancy?
So in the severe cases, we can see postpartum psychosis, which is kind of on the spectrum of postpartum depression. That definitely requires more and intensive care, but all of them are kind of on a spectrum of from blues to depression to psychosis, and addressing them wherever we find that patient.
Okay. Now, why is there a stigma when it comes to women getting mental health care?
I think it's because it's been there so long. So one thing I like to remind patients is you're not alone. This is something we should be talking about. Mental health often impacts pregnancy care more than physical health. But I think it's because it's existed so long, and it's just now coming to the forefront and being something we can talk about more. We can try to let that stigma go.
I just want to add one little question. Is it also maybe because sometimes they try to say women are so emotional too?
Also, perhaps that.
Just wondering, how can partners, family, or friends support someone who might be struggling with mental health after giving birth?
Yeah, I mean, I think it goes back to the last point we made, but ensuring them, kind of removing the stigma for them. And when I see patients or patients with their loved ones, encouraging them to see it as a medical problem, as they would their hypertension or their diabetes. This is their anxiety or the depression. And I think removing that piece for them is helpful so they can see it as a priority. But helping them get to visits, asking them what they need. Lots of patients need different things from their support people. Sometimes it's childcare, sometimes it's attendance at the visits. It can be a lot of different things along the way.
Yeah, or just a conversation.
Also that.
Something as simple as that. When should somebody seek support?
I think anytime they're questioning it.
All right.
So if it crosses your mind, we would love to see you. We have lots of resources, but I think if you're even questioning that you might need a little extra support, then talking about it. I encourage most of my patients to have therapists along the way, just because pregnancy in and of itself without an associated mental health condition is challenging.
Absolutely.
So I think whenever they're thinking about it is a great time.
Yeah, if it crosses your mind, just go ahead and say, you know what, let me call my doctor.
I'd rather address it sooner than later.
For more information, visit metrohealth.org/OBGYN to schedule an appointment with a MetroHealth MetroHealth Women's Health Provider or call 216-778-4444. Or thanks to you, you can also call 988 on your phone to directly get to a MetroHealth provider as well, right?
It's a national hotline to get to a mental
national
health counselor if
Even
you feel like
better.
you're in crisis.
Yes, thank you so much for your time.
Thank you.
And please make sure you like, share these episodes with anyone wanting to have a baby or currently in their mommy journey today.